Gestational diabetes. If you have diabetes and are planning to become pregnant, it is important to involve a diabetic specialist, registered dietitian, and diabetic nurse educator in your care to optimize your health before conceiving. Plan ahead. Poorly controlled diabetes before and during pregnancy leads to an increased risk for miscarriage and a 2 to 3-fold increased risk for birth malformations.
Every mother wants to have the perfect baby and a healthy pregnancy, and all mothers are really motivated to do the best they can to have a baby that's going to be as healthy and thrive in later life. Pregnancy itself puts great stress on your body, and the further along you go in pregnancy, the more insulin resistance you have. So the more likely you are to have a result that's abnormal, the later you are in pregnancy, and that's why we screen so late at 24 to 28 weeks.
Gestational diabetes mellitus, or GDM, refers to glucose intolerance that develops during pregnancy. 3 to 4% of pregnant women are at risk of developing GDM. Undiagnosed or untreated, GDM can lead to large babies. This results in an increased risk of birth trauma to both the mother and the infant. Furthermore, newborns are at risk for hypoglycemia following delivery, as well as jaundice and respiratory difficulties. These children may be at increased risk for obesity and glucose intolerance themselves. Women of Aboriginal, Hispanic, Asian, or African descent are also at increased risk for GDM.
A screen is not a diagnostic test, it's only a screen. It's just like the set of traffic lights. It makes us do further tests, and those further tests are much more rigorous tests, and they will remove those people who've just had a transient abnormal result. And the vast majority of patients that fail their glucose diabetic screen will in fact have a normal 2-hour OGTT, which is a 2-hour oral glucose tolerance test.
Screening for GDM may be done between 24 to 28 weeks gestation. This involves measuring the blood glucose 1 hour after ingesting a 50-gram glucose load. If the 1-hour glucose level is greater than or equal to 10.3 millimoles per liter, GDM is confirmed. Levels less than or equal to 7.7 millimoles per liter are considered normal. Blood glucose levels between 7.8 millimoles per liter and 10.2 millimoles per liter are considered indeterminate, and further testing may be required in the form of an oral glucose tolerance test, known as an OGTT. To perform an oral glucose tolerance test, fasting glucose levels, or FPG, are measured. A 75-gram glucose load is then administered. Levels are again collected after 1 and 2 hours. Abnormal results include an FPG greater than or equal to 5.3. 1 hour after administration of oral glucose, the FPG should be less than or equal to 10.6. 2 hours after administration of oral glucose, the FPG should be less than or equal to 8.9. If one of these levels is exceeded, impaired glucose tolerance, or IGT, of pregnancy is diagnosed. If 2 levels are exceeded, GDM is diagnosed.
Should she have 2 abnormal values on this test, she will be referred to our regional diabetic center where all our pregnant mothers with gestational diabetes would go. And that in itself, I would say, is a very good thing, because it may help her achieve the optimal result in her pregnancy that she wants. Normal blood sugar levels and a normal baby with less chance of complications.
Women who have been diagnosed with GDM are at an increased risk for developing type 2 diabetes later in life. They should be screened 6 months after delivery. Aggressive lifestyle management with nutrition and exercise therapy should be encouraged.
As a new mother, I'm here to offer you some words of encouragement in order to help you maintain or start an active lifestyle throughout your pregnancy. I cannot tell you how important it is and how much easier things will become if you are active during your pregnancy. And this little guy definitely will keep you active afterwards, but during your pregnancy and beforehand, it's easy for yourself to make active choices. For me personally, it didn't make sense to do a lot of walking and running when it was so hard on my back. I ended up having to use a support belt, and I had to switch to a stationary bike. If you are in any pain or discomfort at all, you can choose things that will minimize that, and you'll eventually get to where you want to be. So just try to be active.
Follow the diet plan that you've been given. If your doctor suggests you need insulin, don't resist the insulin. We think we get better and healthier babies if you need insulin and you take it. Follow your instructions about blood sugar monitoring at home. Bring your record with you when you come to see either your baby doctor or your diabetic doctor. Your diabetic doctor will work with your obstetric caregiver to ensure that you get the best possible treatment, and the decisions that will be made for you will be decisions that will be made to ensure that you and your baby have the healthiest possible outcome and delivery.